Hi, my name is Dan Fisher. Today I will be discussing how CT injectors work in the imaging field. A CT power injector injects contrast from the bloodstream, which allows visualization of pathologies that are otherwise not as visually noticed without. We use power injectors in computed tomography, magnetic resourcing, and other modalities. Contrast is most efficient when using power injectors that can be programmed to deliver a certain amount of contrast at a precise flow rate. Power injectors are useful for many types of diagnostic and therapeutic medical procedures. A power injector is useful to diagnose multiple disease processes and enhance vessels. 3 reasons for CT power injectors in the imaging field. Power injectors are able to give a bolus. A bolus provides maximum enhancement of vessels with minimal waste of contrast. Timing. Timing is very important when dealing with contrast media. With the fast scan times of today's scanners, right timing of contrast media is vitally important so we can have the right amount of contrast in the patient to have a quality enhanced scan. Consistency. Power injectors allow consistent flow rates when injecting contrast. With consistent flow rates, it is much easier for technologists to repeat similar scan parameters. Power injectors have a head where syringes and contrast material are inserted. They have plungers. Plungers both draw and push contrast out of the injector heads. An injector is either mounted onto a ceiling or on a floor mount. There is a computer control unit where flow rates and volumes are programmed with the injector. Some cautions of CT power injectors would be blowing tubing. Sometimes we have faulty tubing which can squirt and have contrast go out everywhere. Extravagation. Extravagation is when you have a leaky vein and it will go into the patient's arm, which can cause pain and be very serious. Also, we don't want to exceed the pressure that is given to us on our control console. If we go over the pressure that we have set, the CT contrast will be light through the imaging and it will shut off. Our pressure injection is set to 300 psi, so if we over exceed the psi, the injector will shut off. So now we're going to head over to the control console. The control console has all of our setup protocols. If we are going to choose a routine abdomen pelvis, we can either choose routine, which is right here, or the abdomen pelvis button over here. So let's just go routine. It shows that we're going to be having contrast ISO-view. We're going to be injecting at 2.7 mils a second, and we're going to be injecting 100 mils of that. Also, we'll be using a 2.7 injection for our test injection of saline water. So, again, we're going to come back out here. Here is our injector heads. They're in this package supplied by MedRad. We have 2 injector heads in here. We have all of our tubing in here, and we have both sterile plugins that are able to draw up our contrast medium with this. So what we would do, we would come over here, we would come to our injector, we would push both of these injectors in, we'd push both these in, we'd get the tubing on, or we'd get the injector set up ready. We'd get both of our contrast lit up in here. We'd have saline on the blue side and contrast on the green side. If we were to do a chest, abdomen, and pelvis, we would click auto load, then both lights would fill, they'd come up, we'd hit, it would show 40, it'd show 75, and 100. We would go to 105 on the contrast side and 105 on this side, just so we're not wasting any contrast. We just want to get as much air as we can in there. After that, we would push the air out. We'd then hit prime the tubing, and then we'd hit the check mark that we've also checked our tubing lines. We know that there's no air in there, and we hit arm, we'd be ready for our patient. And that's how Baker City's radiology power injectors work.